Side effects of radiotherapy for prostate cancer usually build up slowly after you start treatment. They may continue to get worse for a couple of weeks after treatment finishes. After this, most side effects improve gradually over the next few weeks.
Everyone's different, and on the whole I think that it's important to point out that the overwhelming majority of people that I treat actually have a fairly modest impact on their quality of life, so they're able to lead a normal life throughout the course of the treatment and in the weeks after treatment. However, there are side effects, and no treatment for cancer is without side effects. And the common side effects are tiredness, which typically develops in week 3, 4 and peaks in the few weeks after treatment.
Most people get tired, especially towards the end of your treatment. It may last a couple of months or even longer. Get plenty of rest. And try to balance this with regular physical activity, such as short walks.
Sometimes people might need medications to help them with that side effect. Incontinence of urine is actually a very rare thing with radiotherapy, and for example, the need to have a catheter inserted, which is everyone or many patients' big worry, virtually never happens. So can it happen? Yes. Does it happen often? Absolutely no.
Radiotherapy can cause inflammation of the bladder. You may need to pass urine more frequently. You may have a burning feeling, or you may be unable to wait to empty your bladder. Drinking fluids can help, but avoid caffeine and alcohol.
From a bowel perspective, probably the commonest side effect of things just being a bit different. So maybe having a little bit more urgency to open your bowels, a little bit more wind, occasional mucus, very occasional bleeding, but that's really not a common event, and people can have looser bowel motions. If they're having a more extensive area treated, then looser bowel motions can be more common. But once again, it's actually a symptom that for the vast majority of people, we're very able to respond to and treat effectively with tablets.
Radiotherapy to the prostate can irritate the back passage. You may get diarrhea, wind, cramping in the tummy, and pain or bleeding from your rectum. Drinking fluids can help, but avoid caffeine and alcohol. You may be advised to make changes to your diet, such as eating less fibre. The skin in the treated area may become red, darker, dry, flaky, and itchy. The skin around your back passage and scrotum may become moist and sore. We can prescribe cream or dressings or painkillers if you need them. Your pubic hair may fall out. It usually starts to grow back after you have finished treatment, but may be thinner than before.
Whilst the overwhelming number of people, the waterworks and bowels do actually get better, and for most people resolve close to back to where they were before they started treatment, there will be a small number of people who experience long-term side effects as a direct consequence of radiotherapy treatment. And for a very small number, perhaps a few percent, they will actually have a significant impact on quality of life. I think it's important to remember these are very much the exceptions rather than the rule, and in that eventuality we are very fortunate to be supported across the region by expert colleagues who are able to assist us, either bowel doctors or urology doctors, in helping manage those symptoms. Perhaps one of the things that we talk least about, because we're men, is sexual function. And sexual functions is a big issue unquestionably for people with prostate cancer. Many people receive radiotherapy combined with hormone treatment, and hormone therapy itself is terrible for reducing sex drive and actually affecting people's ability to form meaningful erections, and that can be a problem both in the short and the long term. Again, there are things that can be done about that in terms of sometimes just through the GP, or in other patients they can access specialist clinics.
Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
Symptoms are very personal, and there will be nothing that you're likely to report that's not been mentioned by so many people before you. The only good thing about having a common cancer is perhaps that we have a lot more experience than we might otherwise have in treating these symptoms, and there's a huge amount of support and treatment available.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.